Welcome to my channel. My name is Chantal and I'm a registered dental hygienist in Kingston, Jamaica, and I'm going to take you along my day as a dental hygienist. So I arrive at work obviously before opening hours to ensure that everything is prepped and ready for the patients that I have to see. As soon as I get to work, I head to the sink to wash my hands before I start touching anything because infection control is very important to me. I have to make sure that I'm safe, my patients are safe, and my co-workers are safe as well. I turn the air purifier on so I can start cleaning the air, and then I turn the main switches on for the suction, the compressor, and the x-ray machine. I also check to see if there's anything in sterilization to be done, and then I do that. I do work with an assistant, so if she gets there before me, then she does the sterilization, and if I get there first, I do sterilization. So you saw me loading the autoclave, and then now I'm going to move to recording that because we have to make sure that we do regular maintenance on the sterilization machine. So I try to keep record of the cycles that are done so that I can make sure that I am doing my regular checks. I then get my PPE, and here you see me grabbing my face shield. I cannot work without it. Fun fact, before COVID I hated these. I thought they were bulky and they get in the way, but after I used it, I realized that all the splatter is getting on the shield that was previously on my face. I know, so I cannot work without it now. I also check to see if there's anything in the cold sterilization from the day before, and I give those a rinse and dry so that when the new cycle goes in, it is undisturbed. I then release the pressure on the autoclave because the timer has gone off, and you want to make sure that the pressure is down before you open it, or else you can have an explosion just like you would if you were using a pressure cooker. I then take the trays from the day before from the sink, and they are then disinfected before they're loaded for the day's patients. There we have the assistant. Hi girl. And then I get to the operatory where I start to set up for my patients. So we do not use the city water on our chairs in the office, so you will see me here filling my bottle and adding it to the chair. So that supplies the water that I'm going to need for the chair, and then I run my lines to make sure that I have an even flow and that nothing is in the line, because that water is going to go in the patient's mouth as well. So you're going to see me doing it here as well on my ultrasonic scaler, because that also releases water, and that's what I use to do the cleanings. Then I'm going to get my patient tray, make sure that everything is on it. I needed an eyewear, so I took it out and made sure that it was clean and clear. They are washed and disinfected from the day before, and then they're placed in that drawer. I also placed my radiation badge in my pocket. I prepared the pre-procedural rinse, which is hydrogen peroxide and water, so that the patients can rinse before they start their procedure. I then take out a new patient chart because the patient that I was seeing earlier was due for exams, so she needed to be recharted, and I took out a bib clip. We do use the disposable ones, so they're not reused on any patients and they're easier just to keep clean. I saw my patient, and then I had a meeting with Prodent where they were setting up a camera on one of our computers at work, so I had to talk to her about that. Here we have a model patient. She's not a real patient, she's a real person, but she's not a real patient. So she was just helping me to show you guys what happens during your cleaning. So when you come in, I put a new clean bib on and a new bib clip as well. I make sure that you get the eyewear And I know that some people uses the dark patient eyewears. I don't support using the dark ones because I like when my patients are in the chair, I'm able to see what's going on with their eyes. So if they were to have a seizure or something, I wouldn't be able to see that their eyes are rolled back if the glasses were dark. So I do not support the dark ones. I then wash my hands before I glove, and I also checked to see that the patient was not allergic to latex, or she had no medical issues or anything that I would have needed clearance for before I started. I am then going to get into her intraoral images, because for every new patient we do take intraoral images and we take bite wing x-rays. So the x-rays are done every year, and I do take pictures if I notice that there's something changing within the patient's oral cavity. So if I see something that I didn't see last time, I'm going to update that patient's records. So I'm setting her up for the x-ray, and then I'm stepping out of the room so that I am away from the exposure, or as much exposure as possible. And then I am just placing everything back where it was before. Now I am getting started with her cleaning. I always make sure that I have Vaseline on hand to lubricate my patient's lips so that they're not dry, because when I go to stretch the lips, I don't want anyone's lips cracking on me. So, and it's also more comfortable for the patients. So you're going to see here that I'm doing a couple checks on the teeth. Of course, she's going to get examined by the dentist, but I also like to look just in case I need to point out anything specific. I am setting her up now. I use a gauze as a cushion for the suction when I rest it there, so it's not grabbing onto the patient's soft tissues. I start with the ultrasonic scaler first, and then I switch to my hand instruments, and if I need to go back, then I do that, but I always start with ultrasonic first. There I have the hand instrument, and I also have a cotton roll so that I can wipe off any plaque, calculus, blood, or anything that comes off on the instrument on the cotton, and then I continue. I then floss, I then scrape her tongue, and then I'm going to polish. So I polish all the teeth, and I also clean the tongue with the polisher as well. I then rinse her out so that she's not uncomfortable with the prophy paste, and then I allow her to rinse out with some mouthwash afterwards. So depending on the cleaning, I would give you a specific mouthwash, or you get regular mouthwash. I also go through oral health instructions with her, so I showed her what came off her teeth and I showed her how to correct it. So she is not a real patient, so after I had the meeting earlier, I then showed her what the instructor showed me for the camera demo. So that's what I did with her right there. And then I'm breaking down my room. I make sure that I remove everything from the x-ray sensor. So I remove the cover, I remove the XCP, I remove the cover, and then I start breaking down the room. So as you can see, I took the headrest cover and I place everything in the headrest cover, just because sometimes you accidentally throw away something, and if I'm putting it in the bag, then I'm able to trace it back. Sometimes patients come in and they throw the denture in on the tray or somewhere, and you think it's garbage. I then start wiping down the chair, so I have to sanitize everything that was touched. I am wiping down as much as possible so that I don't miss any areas, and so that nothing gets cross-contaminated or anyone picks up anything. So I'm just making sure that the environment is clean after I see each patient. So I have to do this after I see each patient. That's a must. It's non-negotiable. every single area that was touched, or even if it was not touched, we do have splatter and we make sure that everything is just clean. It's just the best thing to do, just again, as I said, to make sure that nothing is cross contaminated and that no one is getting infected with anything, because other people have to use the space as well. You also see me changing, or yeah, you see me throwing away the wipes in certain areas because I don't try to use the same single wipe all over the room, because after a while that just, it's not going to work. So I just try to make sure that I am doing everything to the T and by the book so that I don't miss anything, because if you get tired or you get lazy, you end up missing things, and I don't want to do that. I also sanitize the laptop that I touched earlier, and of course the countertop and anything that was touched. I also clean off the X-ray sensor, but not the actual sensor because I can't get that wet, but I do sanitize the cord itself. I also sanitize the chair that I was sitting on, because there is also a little lever on it that I touch. So if I touch my patient, or if I have blood on my hands and I touch it, and then if I go back, if I didn't sanitize it and go back and touch it while I'm seeing another patient, and that patient, the area is not clean, right? I also run the lines to make sure that the suction is clear and disinfected also, because again, we have to share the space with everyone. So we want to create kind of like a blank canvas for the next person to come in. I then put barrier tape on areas of the chair, so like high touch areas. So I know that I'm going to grab the lights often, I put a barrier tape there. I then take my tray to the sink if I have the time, of course, if I have the time, and then I wash my instruments. Again, if I'm available or if the assistant is available, that will get done, but it's not something that you just designate and say, okay, you do this, you do that. If I'm available, I'll do it. So you'll see me doing that, and then after I'm finished with that, I also wash my hands. So every time I come out of the glove, or before I go in the glove, I wash my hands and I dry my hands before I move on to doing anything, because I want to make sure that the area is clean. I had a night guard case, so I worked on that. I then take notes, and right here in the vlog I had some newsletters to edit, so I did. It is the end of the day, and the autoclave is then cleaned with a microfiber cloth and mild soap, and I also grease the handle section of the autoclave. This is also not a task that is designated to one person. So if I'm available and it needs to be done, it's done. If the assistant is available and it needs to be done, it's done. The outside as well as the inside gets thoroughly cleaned. You want to make sure that this is done so that the machine can be maintained and it is kept for a long period of time. A lot of times things break down because they're not properly maintained, so I try to make sure that this is done every single day. The handpieces are also lubricated every day. And it's almost time to go home. So that is the end of the day. And that was my day. Thank you so much for tagging along. If you made it this far in the video, thank you so much for watching. Please consider liking, subscribing, and sharing.